Welcome to Monash's School of Rural Health. Did you know that 1 in 3 Australians live outside a major city? Did you also know that these Australians generally have poorer health and poorer access to healthcare than people living in cities? Unfortunately, the data shows their health gets worse the more remote they are. The problem is that whilst there are enough people with the skills and training, there's a shortage of doctors, nurses and allied health professionals working and living outside of our major cities. Enter the School of Rural Health. We've been working to improve health, healthcare and the health workforce in regional, rural and remote Australia since 1992. We do this through providing immersive clinical placements and undertaking research in regional and rural areas. In Churchill and Gippsland, we teach the first year of the graduate entry medical degree. Right now, the School of Rural Health has 8 major clinical teaching sites in Mildura, Swan Hill, Bendigo, Warragul, Traralgon, Leongatha, Sale and Bairnsdale. Importantly, each of these teaching sites is co-located with a hospital. The School of Rural Health is one of the 4 clinical schools of Monash University's medical school, all within the Faculty of Medicine, Nursing and Health Sciences. We deliver all components of the Monash MD degree. Students in rural and regional areas study the same curriculum as their metro counterparts. They receive great hands-on clinical training opportunities with dedicated tutors, clinicians and experienced educators. History has shown they achieve at least equivalent end-of-year assessment results, and they get to enjoy a great regional lifestyle too. So, how do students get in? There are 2 pathways into Monash's Doctor of Medicine course, known as the MD. 1. Direct, from school entry, and 2. Graduate entry, where students will need to have completed at least one of a number of specific Monash degrees first. Direct, from school entry students can choose to apply for a place in the Extended Rural Cohort, ERC. This is a group of students within the Monash MD who are guaranteed a place with Monash Rural Health in rural and regional Victoria for 2.5 of their 3 clinical training years. The Rural End-to-End program gives students in the Graduate Entry program the same option. Whilst anyone with an interest can do regional placements, students who originally came from regional or rural areas themselves are generally more likely to consider a career there. Monash has agreed with the Australian Government that at least 27% of each year's intake into the MD will come from rural or regional Australia. The Dean's Rural List is the way the university identifies those students and takes their background into consideration when issuing invites for selection interviews. We're not just all about doctors. Nursing and allied health students are also more likely to consider a career outside a metro centre if they've had rewarding placements in a rural or regional location. So, we also support nursing and allied health students doing placements at our teaching sites. Separate to our teaching and training, we lead and foster a program of research aimed at improving the health of rural and Indigenous communities. Our research focuses on 5 core areas. 1. Mental health. 2. Alcohol and other drugs. 3. Chronic illness, ageing well and supportive care. 4. Health professions education. And 5. Longitudinal studies. Over the past 10 years, we've trained around 5,000 students and we currently teach around 350 medical students across all of our sites at any one time. So, we welcome you to the School of Rural Health. We hope you'll enjoy helping to change the face of regional and rural health.